You know, most of us treat our skin like it's just plastic wrap, some kind of passive packaging to keep our insides in.
It's so true. But going through these course notes from the Université de Montréal from their pharmacy and dermatology program,
Yeah.
wow, it's actually a massive insult to the organ.
Right. It's a metabolic fortress. It's immunologically vigilant. It's active. And frankly, it's just so much smarter than we give it credit for.
Exactly. A fortress is the perfect word for it.
So today we're going to get into the physiological bricks and cement of that fortress. We're also going to decode why, slathering on more cream doesn't actually mean more healing.
And we have to talk about the regulatory side, how Quebec's laws, specifically Bill 41 and 31, have completely changed who gets to treat your skin.
That shift is huge.
It is. But to really get why pharmacists are now on the front lines, you first have to understand the barrier itself. It all starts with the stratum corneum.
The notes have this fantastic bricks and cement analogy. It sounds simple, but the biology, it just lines up perfectly.
It really does. The bricks are your corneocytes, basically. Dead cells.
And the cement holding them together is this lipid matrix.
Right, and the composition of that cement is so specific. We're talking ceramides, fatty acids, cholesterol. That exact mixture is what determines if your barrier works or not.
And there's this timeline, this 28-day commute for every skin cell. It starts way down at the bottom layer, migrates up, dies, becomes a brick, and then just flakes off.
That 28-day clock is absolutely essential because when you look at a condition like psoriasis, that clock just breaks.
Breaks how?
It speeds up violently. The cycle drops from a whole month to just 3 to 5 days.
Whoa, so the factory's just churning out cells that have nowhere to go. They pile up.
Exactly. It's a traffic jam of keratin, and that's what creates those thick silver scales you see.
Okay, so clearing that traffic jam, that gets us into the pharmacology. I think most people assume putting on cream is like, popping an Advil. It just goes in and does its job.
But it's not like that at all. The notes here talk about the reservoir effect.
This was the biggest surprise for me in all this material. The idea that your skin doesn't just let things through, it hoards them.
This is so key for how these drugs work.
Yeah.
That cement, the lipid layer we talked about, it's lipophilic. It loves fat.
Okay.
So when you apply a fat-loving drug like a steroid cream, the skin basically soaks it up like a sponge and creates a little depot, a reservoir.
And then it releases the drug slowly over time.
Over days, yeah. Which is why the instruction is almost always apply once daily.
But nobody listens to that, right? The thinking is always, it's really red, I should put on more.
And that's where it gets dangerous. Because of this reservoir effect, a second or third dose doesn't really speed up healing. The storage sites are already full.
So you're not getting more benefit, you're just
increasing the systemic absorption. You're pushing more of it into your bloodstream, which only increases the risk of toxicity. No extra benefit, just more risk.
Once a day is biology, 3 times a day is just anxiety.
Got it. Okay, so the notes also frame diseases as either inside out or outside in. This really clarifies the whole acne versus eczema thing.
Yeah, eczema or atopic dermatitis is the classic outside-in disease. It often starts with a structural failure of the wall itself.
A crumbling wall. The notes mention a specific filigrin mutation.
Yes. Filigrin is a key protein for that cement. If you don't have enough, your barrier is leaky, allergens get in, and then the immune system panics.
So there's acne, which is a cascade that starts from within. Too much oil, blocked pores, bacteria.
A whole shebang. And treating these conditions means you have to choose the right vehicle. A cream, an ointment, a lotion. They're not interchangeable.
The rule in the notes for this is so catchy. Wet on wet, dry on fat.
It sounds a little cryptic, but it's just practical physics. If a lesion is wet, oozing, like acute eczema, you put a water-based cream on it, you want it to dry out. Wet on wet.
But for a dry, thick psoriasis plaque, dry on fat, you need grease. A thick, occlusive ointment that traps moisture underneath and hydrates that scale. A watery lotion would just evaporate and do nothing.
And this kind of complexity, knowing the vehicle, the reservoir effect, the pathology, that has to be why the pharmacist's role, certainly in Quebec, had to evolve.
That brings us right to Bill 41 and 31. The days of a pharmacist just being a dispenser they're over. They are now actively evaluating physical symptoms.
So they can prescribe directly for something like acne or eczema if you've been diagnosed before.
Right, or prescribe stronger over-the-counter agents. They're trained to spot the difference between a simple rash and a real medical emergency.
There's a section here on red flags that's pretty serious. The one that jumped out was pain disproportionate to the injury.
Oh, yeah. That is the scariest one. If someone has a tiny cut, but they are in absolute agony, A pharmacist is trained to think that could be necrotizing fasciitis.
Flesh-eating disease.
Right. And that is an immediate, no questions asked referral to the ER. It's about triage, right at the corner store.
It just ties everything together. We've gone from the microscopic cement in our skin all the way to the legal frameworks that empower the person at the pharmacy to treat it.
It turns the pharmacy into a real point of care.
So, one final thought to leave you with. We talked about bacteria and acne, but the notes imply that dysbiosis, an imbalance of bacteria, is the real problem. If our skin actually needs a healthy microbiome to function properly, does our modern obsession with, sterilizing everything and using harsh cleansers, are we accidentally destroying the very fortress we're trying to protect?
That is the question to ask next time you wash your face.
Thanks for listening to The Deep Dive.